Hello everyone, I am Dr. Ankit Vijay Agarwal, consultant gastroenterologist at Renova NIGL Hospital, Banjara Hills, Hyderabad. Today's topic for discussion is colon cancer. Colon cancer is a dreaded condition. Initially thought to be more common in the Western countries with a very low incidence in India, the scenario is now changing. Changes in diet, lifestyle, increased obesity are all contributing to an increased risk of colon cancer in the Indian population as well. What is more disturbing is that now we are seeing a younger population who is presenting to us with advanced cancer, and hence it is important for the general population to know about colon cancer and what can be done to get evaluated and treated in the earlier stages itself. The large intestine in our body is known as colon. The distalmost part of the large intestine is known as the rectum. Together, cancers of the colon and rectum are known as colorectal cancers. What are the symptoms of colorectal cancer? Initial stages, these cancers do not have any symptoms, and that is why they become more dangerous. When you have symptoms, it usually involves a change in your bowel habits, that is frequent diarrhea, frequent constipation, change in the form, texture of stools is seen. Some people can have pain abdomen, some people can see blood or black color stools, while some people only complain of extreme tiredness, fatigue, weight loss or loss of appetite. Evaluation of colon cancer usually involves an initial test known as colonoscopy. In this, a specific pipe with a camera inside is used to examine your large intestine by inserting the pipe through the anal canal. Through this, we can directly visualize your colon and accordingly see if there is anything abnormality. Biopsies, if needed, can be taken at the same time. Once you have a diagnosis of colon cancer, further evaluation is needed. This is usually done by doing CT scans, including PET CT scan, based on which we can know what stage is the disease. After all this has been done, treatment is initiated in the form of surgery, chemotherapy or radiation, including all of these or either of these depending upon what stage and the location of the tumor. Important for me to tell you here is that how can we prevent colon cancer or how can we diagnose cancer in an early stage so that it can be treated easily without major risk to life. Here comes the role of screening colonoscopy. In Western countries like United States, there is a standard protocol for screening colonoscopies wherein every person above the age of 50 years has to undergo a screening colonoscopy once. This screening colonoscopy is done basically to look at the large intestine on a regular basis before you have symptoms of cancer, or if any cancerous or precancerous lesions are there, to detect them earlier so that we can halt the disease in its initial stages only. So this system is not there in our country, but we recommend all our patients over the age of 50 to get a screening colonoscopy done once to see if there are any precancerous conditions like polyps or ulcers, and if anything is there, to get treated accordingly. If nothing is there, we usually ask them to do not worry and follow up. If we find polyps or any other things, they are treated and followed up accordingly as per the guidelines. Okay, so I request all of you to please consult your doctor if you have any symptoms that look like could be related to colon cancer, or if you are above 50, to get a screening colonoscopy done to rule out any cancerous or precancerous conditions. Thank you.